Let me start today with Dr. Andy Thomas. He's joining us by Skype. Dr. Andrew Thomas, Chief Clinical Officer at OSU Wexner Medical Center, as he's been advising me, my team throughout this pandemic. He was involved in helping us develop our public health advisory system, that color code that you're now seeing every week that we talk about. And Dr. Thomas, thanks for joining us. We appreciate it very, very much. Appreciate your time. And why don't you talk a little bit, because we're going to be talking later in this press conference about the color code and what the changes are. Every week we're going to announce the changes, usually on Thursday. And I know the data team went over the data yesterday and into today. But before we show everyone what changes there have been, I wonder if you could just describe for us how this system works. You have 7 indicators. How did that all come about?
Thank you, Governor, for the opportunity to be here today and to be involved in the process. I think a couple of important messages in summary about the public health advisory system. One would be what you just mentioned. It's not based on any one single metric. It's based on a group of metrics that when you look at the trajectory of each and every metric, you see a trend that will, for any one geographic area of the state, provide an early warning that there are issues related to COVID-19 that need to get the attention of either local healthcare providers, local businesses, local schools, really the population in general. It's not meant to be a grade. It's not meant to be any sort of anything beyond a warning, much like a weather forecast might be, a warning of a storm coming in the future. It doesn't do much good to get a weather forecast when you can already see it raining outside. What this system is designed to do is to look forward. Where is the virus going in our community, to make sure that the proper messaging, the proper steps are taken in that community to try and reverse any trends of worsening infection. So it's not just one metric, it's a collection of metrics. That way, any one metric might be imperfect, but if you have 3 or 4 or 5 metrics all trending in a worsening direction, it helps make sure that you're giving accurate information out to a region of the state. And then, as I said, it's really meant to be an early warning. Now, there are a number of the 7 indicators. There are 5 that I would call leading indicators. They're showing where the virus is going. What's the trajectory of where it's going in the last week or two and into the next couple of weeks? The first, and probably, I think, in some ways the most important of the 7 metrics, although they're weighed equally, is new cases per capita. What per capita means is normalizing the number of new cases based on the population size of the area. So what this metric does is takes the total number of new cases over the past 2 weeks, and it looks at what is that rate per 100,000 citizens. So that allows us to normalize for a larger county like Franklin County, a medium-sized county like Stark County, or a smaller county like Athens County to determine what's an equivalent rate of cases per 100,000 people. Based on CDC guidelines, anything above 50 cases per 100,000 in the past 2 weeks would be considered moderately high incidence of new cases. Anything above 100 is high, and anything below 10 is yellow. So the impact on the system would be if your county is less than 10 cases per 100,000, no matter what any of the other metrics say, your county is going to be yellow because the incidence is so low. If you're above 50 into that moderately high category, then you are going to trigger this metric. And if you trigger it and stay above 100 cases per 100,000 over the next 2 weeks, then the metric will not untrigger and you'll remain either red or higher. So this is in some ways a very important metric to look at what is the burden of this illness in our community over the past 2 weeks, and then the trajectory of where it's been and where it's going. 3 other metrics that are also considered leading indicators deal with looking at trends of worsening data over a 5-day period. 2 of those relate to symptoms that patients describe when they either go to the emergency department or when they go to their provider's office. The symptomatic surveillance of viral illness is something that's been used for years in influenza. It's something that we have trending data on, and we can see if there's a rapidly increasing trend over the last few weeks of 5 days in a row of sustained increase in either in the emergency department or in providers' offices of people coming in complaining of viral illnesses. That will flag those two metrics. The other metric, which is also a leading indicator, is about sustained increase in new cases. So what this does is take all of the new cases as they're reported based on the date that the swab was done, not the date that the test is returned. And it looks, once again, on a 7-day rolling average for a 5-day trend of increasing cases over the past few weeks to see that the disease is escalating in terms of the actual number of new cases. So different from the first metric, which is normalizing it based on the population, this is normalizing that trend based on that county's previous history. So if they're increasing in terms of the absolute number of cases compared to their baseline, that would flag. And the last of what I would call a leading indicator relates to congregate settings. So what we really want to try to measure with this alert system is what's going on in the community, not particularly in a congregate setting, although we care very much what goes on in a nursing facility, a local jail, or a local prison. To some degree, that may not have a lot of impact on what's actually going on in the rest of that community. So this metric is designed to not flag if greater than 50% of the cases each week over the last 3 weeks have actually just been in congregate settings. But if in any week in the last 3 weeks, greater than 50% of the cases are in the community of the new cases, then this metric will flag, which shows that there's community spread, not just in congregate facilities that may be driving the total number of new cases. Those are the 5 what I would call leading indicators, and then there are 2 lagging indicators, and those mainly relate to hospitalizations. We know based on data that's been published that from the time someone contracts COVID-19, they typically don't end up being admitted to the hospital the next day. They're typically sick or symptomatic for a period of time, oftentimes 7 to 14 days before they even present for hospitalization. What these other two metrics look at as somewhat lagging indicators look at the rate of new hospitalizations by the county of residence for the patient. So it's not based on the location of the hospital. It's based on the zip code where the patient lives. And what that looks at is, once again, a sustained 5-day increase in the 7-day rolling average for new admissions to the hospital for patients with COVID-19. That will flag the metric. So once again, a rapid increase over over a 5-day period. And the last metric really relates to hospital capacity. It is about how many ICU beds are filled in an entire region. So for those who aren't familiar, the state is separated into 8 emergency management regions, and we have managed this illness through the Ohio Department of Health and through the medical community based on those 8 regions, whether it's supplies, whether it's testing, whether it's how we manage hospitalized patients. So we look across those 8 regions, and if any region has had greater than 3 of the last 7 days with more than 80% of their ICU beds occupied, that will flag the metric. Now, they don't have to be occupied with COVID patients, but what this is a metric of is how full are our hospitals, because if all of the other things are trending, showing worsening signs of COVID-19 in our community, will there be hospital beds not only to take care of those COVID patients, but also patients who are having heart attacks, strokes, traumas, and other things? So if you get above 80% for an entire region, the counties in that region will flag for that metric. So once again, to summarize, 7 metrics, not 1. It's a mix and a balance of those. And it's really meant to be an early warning system to forecast where it's going in any one community so that the citizens of that community can take appropriate action to reduce the spread and bring it back under control. I should mention that the way the color coding system then works is if your county flags 0 or 1 of the metrics, you're yellow. Or as I mentioned, if you're less than 10 per 100,000 over the last 2 weeks, you'll be yellow. If you have 2 or 3 of the metrics that flag, you will be orange. If you have 4 or 5, you're red. And if you have 6 or 7, you're purple. Governor, I think if you have any questions, I'd be happy to go through them, but that's my basic summary of the system.
Well, thank you very much. I think that's a great explanation, a lot better explanation than I did last week. So that's why we asked you to come in and give
You did wonderfully, sir.
give the explanation. So I live in a county that is, let's say I live in a county that's yellow. What should I think about all this? And then do the same thing for orange and red and purple. Start with the yellow. We still have a lot of counties that are yellow. We're seeing things change today, but what should I be thinking about this?
So that's a terrific question. I think one of the things you should note about the map, I know you're going to go through this later in some detail, is that none of the counties are green. The reason none of the counties are green is no matter what county you live in, you are at risk for contracting COVID-19. There is activity to some degree across the entire state. Until we have a vaccine or until we have a pharmacologic medication treatment that is known to stop the incidence of the disease and the spread of the disease, no county really will be anything less than yellow, because no matter where you live, you are at risk for this. So I think as it escalates from yellow to orange, that will tell you that the incidence in terms of these metrics is showing that there's more disease in our county. Now, I think last night, sir, in your speech to the state, you made, I think, a terrific plea to citizens outside of the red or purple counties to wear a mask. I think one of the key things that individuals can do to try and stop the spread of this disease is wear a face mask. It's what we call source control. Some small percentage of patients who have COVID-19 are what are called asymptomatic positives, or in some cases pre-symptomatic. So for up to 48 hours prior to developing symptoms, you could potentially infect other people. Through no fault of anyone, in that case, if you have no symptoms and don't know you're ill, you could be spreading that disease to your neighbors, to your families, unless you wear a mask, keep 6 feet distance between you and others that you don't live with routinely. Wash your hands routinely with either soap for greater than 20 seconds or with hand sanitizer. And then certainly cleaning high-touch surfaces. That's mainly something for businesses in terms of countertops, doorknobs, elevator buttons, and so forth. But no matter what county you live in, those 4 things, face masking, social distancing, washing your hands, and cleaning high-touch surfaces, are the things that all of us should be focusing on to make sure your yellow county doesn't become orange, red, or purple, regardless of what the current rate might be.
Orange as opposed to yellow, what's that tell me?
Well, I think orange means that the storm's getting closer. It means that the wind's getting a little stronger. It means that there are either more cases or an increasing incidence of individuals saying they have symptoms of COVID. It may flag because suddenly what used to be a problem in a local nursing home is now a problem in the community. So it's once again going from either 0 or 1 indicator flagging to 2 or 3 just tells you that on average the data is getting worse for your area. Not enough to be red, but certainly worse than yellow. So I think once again, more focus on those 4 interventions: wearing a mask, keeping your social distance, washing your hands routinely, and then washing high-touch surfaces.
In red?
Well, red, based on the public health order from a couple of weeks ago, red requires face masking when out in public, when you have a reasonable expectation of being around other people. So if you're out walking your dog on the sidewalk and you're not going to stop and talk to your neighbors, you don't need to wear a mask. But certainly if you're going into local businesses or you're going to be directly interacting with others, not kind of outside of those you live with in your home, you really need to be wearing a mask in those red counties. You know, when you think about it, Governor, there's a reason why surgeons have worn masks in the operating room for over 100 years. It's not really particularly to keep the surgeon from being infected by whatever they're doing with the patient. It's because we know that when the surgeon breathes or the anesthesiologist breathes or the nurse breathes, they're breathing out bacteria that can cause a wound infection. So the source control of a mask is really important if you're one of those asymptomatic positives. It keeps you from having others be at risk of spreading the disease. It's the primary use of the face mask. At the same time, if someone else either doesn't have a face mask on, or even if they do, but maybe they're not wearing it perfectly, they're wearing it below their nose or whatever it might be, you wearing a mask also can protect you for those droplets that are in the air because that person's either not wearing the mask correctly or not wearing one at all. So mainly the mask is to protect others, but it also provides protection for yourself.
And purple?
Well, I think purple is, we haven't had that experience yet. We've had a couple of counties that have been flagged for potentially moving to purple. I think almost by definition, that means that you are flagging the two hospitalization metrics, either that your hospital ICU beds are generally full across an entire region, or the residents of your county have an increasing hospitalization trend. I think it's obviously the most concerning set of circumstances. It's the disease is not only trending worse, it's kind of already there and bad. And I think purple is where certainly local health leaders, local community leaders really need to think about other options that they may take to try and stem the tide of the disease beyond where we're at with the face masking order for red. I think in no uncertain terms, it means that the storm is there and the winds are blowing really hard. And if something isn't done about it, it will just continue to worsen, somewhat like what we're seeing in Florida or Arizona or some parts of Texas. It's there, and it's going to take a while for that storm to recede. So the goal is to have no one ever have to get to purple. Like I said, this is not a grade. This is a warning system, an alert system that will help people understand when they need to step up their I mean, I personally wish people would wear face masks, as I said, in the yellow or orange counties without needing to be ordered to do so. I think that would be one of the most effective, and I think most medical experts across the state would agree with that, as one of the most effective ways to prevent you from becoming red. But the goal is this is not a grade. This is a warning system and a chance to allow local people in the local community to understand what's going on so that it's not one score for the state, but it's really tailored to what's going on in your local environment.
Great. Dr. Thomas, thank you. We appreciate it.
Thanks for having me, sir.
Thank you very
Take care.
much.